Okay, good evening, everybody. I apologize for the delay in getting started at 6:03, September 20th, 2022. Call the Macon County Health Department Board meeting to order. Roll call, Susan.
Mark Scranton.
Here.
Jeff Antler.
Here.
Candy Clevenger.
Here.
Carolyn Wagner.
Here.
Jan Hack.
Here.
Debbie Hill.
Here.
Dr. Jurger.
Here.
Dr. Menegatti.
Yes.
Cody Parks.
Here.
Dr. Jeffrey Smith.
Here.
Dr. Snyder.
And as a reminder, by being present, you are being recorded. The meeting's going to be recorded.
Good stuff. Okay. Ask everybody to please rise. Join me in pledge allegiance. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I'd like to motion to approve the agenda topics as presented. Motion. Second.
Who first? Excuse me.
Jeff. And
Jeff.
Dr.
Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill.
Yes.
Dr. Jurger.
Yes.
Dr. Menegatti.
Yeah.
Cody Parks.
Yes.
Dr. Smith.
Yes. Okay, do we have any public comment, Brandy?
None that I can see present, and just what was in your packet that was received in the email.
Okay. All right, motion for approval of previous meeting minutes. We have the Finance Committee meeting minutes from August 16th, and then the Board of Health meeting minutes from August 16th, and we will vote on those separately. So Finance Committee minutes, like any changes, corrections, or additions? A motion to approve them as presented.
I didn't get it.
Mark and Cody.
Thank you. Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill. Dr. Jurger.
Yes.
Dr. Menegatti.
Yes.
Cody Parks.
Yes.
Dr. Smith.
Yes. Okay, motion to approve Board of Health meeting minutes from August 16th, 2022.
Second. I'll make a motion. Accept.
Roll call.
Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill.
Yes.
Dr. Jurger.
Yes.
Dr. Menegatti.
Yes.
Cody Parks. Dr. Smith.
Yes. Okay, we're going to be jumping around on the agenda a little bit for the sake of trying to accommodate some of our people that are here. So I guess the first thing we'll jump to is discussion and action on masking policy. This has been brought up the last two meetings, and it was pointed out last month we need to make sure that this is on the agenda for discussion and action this month. And so I'll let everybody have the floor and speak to this. What everybody's positions are as of right now.
Unless someone has something different, we already did talk about that last time, so.
We did. I think the only thing that was in question, and I think Rachel's back there, isn't she?
Yeah, I was able to ask on the CDC call this week, and they are in the last stage of the legal process. They have not released the new information. They have said it would come out at the end of this week or beginning of next week on that call.
And that's in regards to what we talked about with staff.
That is in regards to healthcare facilities and COVID rules.
Okay.
In clinical settings, correct?
In healthcare facilities in general, that's the rules that they are updating.
Well, I was looking at the personnel manual because it's one of the things on the agenda for tonight's discussion. And in the job classification, the very back of the manual, you guys have a copy of that. It listed the positions for staff that works here at the health department. And although this does not specifically include COVID, it does include a lot of other potential hazards. And you'll note there, looking through that, you'll see there's quite a few positions that are classified as not at risk categories. And then there's level 1s and level 2s. Having talked to some other healthcare professionals and stuff, I'm of the belief that we're at a point in time where I think people should have the ability to make the decision based on what their comfort level is and as it relates to their specific jobs. I think it's important that people feel comfortable making the choice that best suits their needs specifically. But at the same time, I think there's some people that would probably appreciate the fact of having the option to do what they want to do. So tonight, for this conversation, I would not only like to have some action taken on behalf of the board, making its own decision. I think trying to lead by example is important, and part of that, I think we should include those that have worked through all this and are probably at a point where they're ready to move on also. I think there's some categories here within the facility that warrant continuing of masks being worn in certain situations. And I think that's open to probably interpretation by administration, but I think this job classification exposure guideline is definitely helpful, because you see a large majority of our staff that's here is not in settings that they're basically not at risk. But if somebody felt the need to do that in their own workplace environment, felt comfortable, doing that, then I would by all means encourage them to continue to act as they see fit.
I would just like to ask a few people if they have, like, at Memorial Hospital, do you still wear masks there?
Yeah, they did.
Okay. Do you wear masks at your office?
I was reading the pictures. Front staff does not.
Do you
I'm
wear
sorry.
it at the Macon County board meeting,
No, we do not.
at courthouse?
No.
I am in a restaurant and we don't wear them. And I have not seen one person have a mask on in months.
We do still wear them.
Pardon?
We do still wear them. Heritage. We still wear the mask.
Heritage.
Heritage, okay, yeah.
What is that?
Well, four,
We
yeah.
still wear the mask.
I don't wear them in my office, and I don't require patients to wear them in my office.
I just kind of wanted to get a feel who did, who didn't.
I think it also depends on your risk of exposure to patients in the COVID, so. Me being with the patients all the time, I don't know if that's COVID or that's not, so I'm at risk. So if I'm exposed to someone that I did not know about, then I'm probably risking you guys. So that's where our philosophy comes, not to expose someone who did not have an exposure. So that's what makes me wear the mask, not for my own sake, but not to strategify where to had some contact with a patient in the hospital.
I completely respect that and understand that, and that's why I think it's important that people have that ability to make that decision.
I think we're continuing to screen as we come in here. We're all taking our temperature. We're all not coming if we have physical symptoms. We're in a non-patient care setting in a boardroom. So, and we're spaced out. And I think for my own personal opinion is that in a setting like this, it should be optional.
I did. I second
Okay, so I will present this as two separate issues then. We have a motion on the table to change the masking policy in regards to board meetings and make masks optional for meetings. Is that your motion?
That would be mine.
Okay, is there a
I
second?
would second that. Debbie Hill seconded it already.
Okay, roll call?
Mark Scranton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger.
Yeah.
Carolyn Wagner,
Yes.
Jan Hack,
No.
Debbie Hill,
Yes.
Dr. Minigati,
No for now.
Dr. Jurger,
Yes.
Cody Parks,
Yes.
Dr. Smith.
Yes.
What was the vote on
2
that?
to 9, no, let's see, there's only 10 here tonight, 2 to 8.
So is that starting?
So motion's passed.
Oh, very.
Okay. So, now, the other issue in the conversation is how we treat staff. So, I would like to hear opinions from the ladies around the corner back there, if they don't mind stepping out where we can see them. Because you guys are the ones that are in the trenches working with the people every day. What is your guys' feelings amongst your personnel? What you guys would like to see?
I can start. I'd like my staff to stay masked. We are vaccinating for COVID, so we are seeing people who are not up to date every day. We did a big clinic in this room this morning, and we go into homes as well, so I think it's important that we're protected.
And I would wholeheartedly agree with you that, Rachel, because you guys are in what I would consider my interpretation of reading the job classifications. You guys are in level 2, is that correct? Would you consider yourself being level 2?
I'm not sure what you're referring to. I don't have that paper in front of me, so I can't really judge. I don't know if Brandy can answer that for you since she's got it there.
Yeah, risk level 2 is you, Rachel, so it would be most of your staff. And I
Okay.
think something, so this, just so everybody knows, that particular document is referencing the risk of exposure to staff of some of the health issues that are listed in the personnel manual. But when we have made the decisions about staff and when they should be required to wear masks, we're also taking into account the risk that we present to the people that we go see. So obviously the safety of our staff is utmost importance, but this exposure classification does not necessarily represent, like when we go into seniors' homes and do, case management for them, we also want to keep them safe. So that's something we've always taken into a lot of consideration, is not just our staff person being safe from the person that they're going to see in their house, but also that we are keeping that person safe just in case our employee is sick and doesn't know it.
And I appreciate that, Brandy. I guess what I was trying to get to was, is it the desire or the will of the staff that you guys have a mask option for what I would call the not risk categories, or do you want to continue that everybody participates uniformly across the board? Because I think you guys deserve to have a voice in what you would like to see going forward.
I can speak only for myself because I didn't know this was going to be brought up or asked or whatever, but what I can say is I follow people who have more expertise than me. I have no clue about chronic diseases and things like that and infectious diseases, so I just follow what people that I trust and who do have expertise in that. So I can't really speak. I just follow.
But Marissa, in your work environment right now, as it is presently, are you interacting with people? So I guess where would you fall in this classification?
It depends on the day. So sometimes when I'm out in the community, I'm obviously working with large groups of people, and I would probably likely continue to mask for that reason, because I don't know their vaccination status, I know mine. But like in my office and things like that, or if I feel like it's a low exposure, in my office, it's just me, so obviously I'm not masking, but it also depends on the comfortability of the people that I'm in the room with. So I just try to respect, guidelines, and I'm a rule follower, so for me, it's, like I said, I rely on people who are smarter than me, so.
Brandy, do you have enough staff, I guess, so we don't have to linger on this conversation? Do you have enough staff that are working in their offices that aren't really having any direct interaction with people, that you feel that this would be warranted to give them the option not to, or do you think it's gonna cause more conflict because people are looking at saying they working over there doing that, they don't have to wear a mask, I got a job over here, I have to wear mine. I don't wanna make this, complicated or controversial in terms of how people feel about their job role dictates they have to do this.
Well, right now, if someone's alone in their office now, they don't have to wear a
Okay,
mask.
I didn't know
So-
what you guys' policy was in regards to that.
But to answer your question more broadly, I do think it would present some issues among staff, which is something else we've taken into consideration. Another thing that could cause a little trouble is that right now the guidance is if you have had COVID, there's a certain time you can come back to work, but you have to be masked. And so then it would be very obvious if they had COVID and were wearing a mask versus everybody else not wearing one. We have talked in great length with the supervisors and, and administration about when can we lessen the requirements for masks so that everyone doesn't have to wear them all the time anymore. But there are just so many caveats with the work that our staff do that make it difficult, that there's just, a lot of intricacies that we say, if you're going into a senior's home, you do have to put it on. Or when you're going to their home, ask them, do they prefer that you wear a mask? Would that make them most comfortable? Or if an inspector's going into a restaurant, if that particular restaurant is masking, that our inspector respects, their comfort level of wearing a mask. So there's just so many intricacies, case management, going into people's homes, small offices where you have clients coming in and they can't social distance from you. So, I do think that we're getting to a time that we need to, move forward, but also just because there are so many intricacies, and then my concern about some of the issues that could come from that, and then also that whole wearing a mask if you've had COVID and coming back to work, that concerns me too, because then basically people's health, status is kind of broadcast on their face. So, that was why I really heavily leaned into, getting some support, from legal as far as like, where do you think we should go with this? That way I at least felt like if anybody made any complaints, accusations, if they were upset about wearing one, if they were sick, that we at least had that kind of, backing there before we move forward, because we definitely, adhered to being as safe as possible, as strict as possible with it.
Okay, so I think we'll table any action in regards to the policy with staff right now then.
And Mark, I'd just like to make a comment, as you look around the room, there's never been a standard for masks. This is one of the things that's always bothered me about masks. I've traveled, been on planes where people are masked. Some of them look like they're, lingerie that was cut out and had some rubber band crocheted onto it, and that's very fenestrated or hold. And just looking around the room today, Dr. Menengati's got two on. Some are cloth, some are paper. I don't know the standard of that paper.
We do have a policy.
I don't know the standard of yours, and the black ones, whether they're cloth or this or that. And so, for me, just as a physician, I thought, every mask is the same. If the policy were wear an N95 and everybody wore an N95 that has a standard, I really understand that, and I get that. And when I was exposed in the hospital, to somebody who has COVID, I wear an N95. And even that's not as protective as maybe a hooded mask that we wear in surgery. So, I think that the mask kind of gives people a false sense of protection, a false sense of security, because if you're truly going into homes and being around people that have COVID, I would wear more than just the masks that are being worn in this room. I would wear an N95. And that's what I would recommend for the healthcare workers in this community. If you're around people who are exposed, now Dr. Menengati may have a different feeling about that, but I think that, we don't even know the standard of protection of, say, your mask versus your mask. Maybe you have a 10% protection. Maybe yours is 3%. Maybe the cloth ones, they say, are worse than nothing at all. And so I think that needs to be taken into consideration in all of this as well.
For sure, I appreciate that, and I will say we do have a policy for staff that they have to wear a certain type of mask. We don't go into people's homes or serve people who do have confirmed COVID-19. And then when we have gone into facilities, primarily long-term care facilities, when we were assisting with the response early in COVID, we did, require, of course, those staff to get fit tested and wear N95. So we definitely have been mindful of that because I understand where you're coming from, for sure.
Randy, do you guys have inventory of N95 masks?
We do, but only the staff that have been fit tested are using the N95s. So any employees that it would be appropriate for have been offered to go to fit testing, and that cost was covered by the health department, and then they were provided the PPE that they needed. So all of that's been taken care of, and then any of the masks that the staff are required to wear, those have been provided by the health department as
So
well.
you got people that will wear a mask, but they don't want to get fit tested, if I understand you correctly?
Can you repeat the question?
So you're saying you got people that will wear a mask, but they won't go get fit tested or wear N95?
Well, I mean, that's like all of our staff. All of our staff didn't really ever need to go get fit tested for an N95. It wasn't
Mark,
necessary.
getting fit tested for a N95 mask is a big chore. So they've been trying to do that in the hospital setting for a while, and they have not been able to get all the personnel to do it. Every time they talk about it, it takes a while. That, having said that, I mean, containment of infections is not an absolute thing. You cannot, whatever you do, except for the foods that we put in.
Yeah, positive air.
Yeah, that probably I would say is 100% if you do it the right way. But everything else falls short of it. So if someone wears an N95 and that's not properly fit tested, yeah, they're likely to get infections. And if someone does not really use a mask the right way, they might get infections. So again, with different types of masks, having different filterable, whatever the quotient is, the risk is always there. Even with the mask that I'm putting on, the risk is always there. But try to contain as much as possible.
Right, because you can wear a positive air supplied respirator, and if you've got facial hair on a given day,
That's another thing.
I'm not gonna make it through
right.
fitness
Yes.
test. I mean, I've done it, so I know exactly what you're saying. Okay, so we will table that for future meetings and get some updates, hopefully, from staff moving forward, so. Okay, we've got some other things to jump to here, but, I guess we could go where we got discussion approval of the budget and the pay scale is under old business. Not much to update on that, other than we discussed it last month's meeting. It was approved, it was taken to the finance committee. I understand they approved it, and now we're waiting for it to go to the county board next month. Is that correct?
That is correct, and I did just want to make all of you aware that we have reviewed the meeting minutes from the finance committee budget hearings, and there has been some offers and discussion of moving up, percentages, and so, I did talk to them about the pay compression and things that we're experiencing now with the tiered system that we implemented, and just told them that we were speaking with the board and that we'll keep the finance committee updated about, trying to figure out how we can address that as we move into future years as well.
Okay, update on Popeyes. Anything new?
The only thing with that is, no update, but they are going to come in November to, per the board request to give their update there.
Okay. We have flex time for pay policy on the agenda, but we did not have everything we have to have a proper conversation about that tonight, so we're going to table that until next month's meeting. There's some questions that were brought up and some additional information that we need to have. I will speak on behalf of Mr. Jackson, who was supposed to be here present tonight, just to kind of convey what his presentation was going to involve. Jeff and I had a conversation with the treasurer the other day in regards to trying to have him come to the board and kind of discuss how the levy process works, to kind of educate everybody what has to be done, because levies have to be revisited every year, and there's a deadline that has to be done. We don't have that need right now to pursue that in any fashion, but I thought for informational purposes, it'd be good to have him have that conversation with the board. But part of that was we were discussing some options for what we could do with the reserves that we have in the health fund. There's a lot of opportunity to make our money work for us. And I think it's important as representing the taxpayers of Macon County that we not only, set policies that make sense, but we also take appropriate actions for being responsible for how the taxpayers' money is utilized. And one of those things that I think has been lacking here is with the reserve we have in the health fund currently, after we discussed this at great length over the last couple of months, going over the budget and everything else, it's become apparent that we maybe need to explore some options in regards to how that money is being invested, because currently it's not being invested in such a way that we can get a return on it. So the treasurer had presented some options to us for purposes of the conversation, and just to kind of give you kind of an overview of what the conversation was, we could put the money into some funds that are rated, that are cleared through the county, that are rated to where the money would stay safe without any risk at all. There's actually a lot of money the county can be invested overall right now, but we could be getting pretty good return on our money. If we start looking at the budget, this is what got me thinking about this. There's things we could be doing if this money was invested properly that could bring back somewhere in the neighborhood, correct me if I'm wrong, we were talking about different, depending on what side do, we're talking anywhere from $200,000 to $300,000 potentially that can be brought back to the health department specifically by merely just putting this money to work for us. There's some options with some funds that they have. There's also an opportunity with some treasury notes that are paying out about 3.5% right now, which is still way above getting locked into a CD type of investment for a specific period of time. The nice thing about these funds that he alluded to was within 24 hours, we could get our money out if we got ourselves in a situation where we need. So this gives us a great deal of liquidity with this. But if we can get 3 to 5% on our money with what we have right now, that's pretty significant, guys. And we're not doing anything about it. And I would like to see us be able to move forward with the conversation of what vehicle we might use to facilitate that, but also how much we would like to commit to it. One of the recommendations was regarding the treasury notes, we would take, I'll make a number, we'd take like $500,000 or $1 million or whatever, and you drop that in to some notes. You do that, and then 30 days later, you do it, you repeat the process again. So you're putting your money in over time. So by the time you make your fourth deposit, your first one's getting ready to kick back out. And then we'd have that money that we could turn around and reinvest it, or the interest we would accumulate off of that investment, we could roll it right back over. And it's a staggering amount. When you take the numbers of what we got right now and calculate that out 3 to 5%, it's a significant amount of money. It would help to fund pay increases potentially. It could help to fund other capital expenditures in the form of equipment, our security stuff we talked about, trying to get that done. That's $100,000 that we're staring at potentially to get that worked out. And the fact that we have it, we got to do something with it. And I think the best thing to do is to put this money to work for us. We can't walk it back. We can't write a check to the taxpayers and say, here you go, here's your money back. I looked at my property tax, for example, myself, it's $300 a year. And that might give people momentarily a little bit of excitement and say, oh, I got a check from the county. That's great. But a month from now, you'll never remember that it happened. So I think the best thing for us to do as a board is to do our due diligence and research what the recommendations are by the treasurer. And he's having this conversation with other departments throughout the county because there is a lot there that could be invested, that could return a lot of money to the county. And I think that's a really important thing to do. You don't take all your money that you make. Personally, I don't put all my money in a checking account. I've got it in various instruments that I feel comfortable with because I want my money to work for me. It's the only way you can get ahead. And I think looking down the road, if something happens and we have a a need for some additional funding. Maybe we lose some grants and we want to keep some people working because some of the tasks that are getting done under a grant are no longer funded, but we want to keep that person on board. Those types of things could be very easily justified if we can reinvest this money and put it to good use. So that was what the treasurer was going to talk about tonight. And Jeff, you got anything to add to that?
No, maybe one thing, I think you're probably all wondering what the risks are. There are virtually no risks. They're very,
The notes are totally risk-free.
yeah, there's no
You're
volatility.
guaranteed going in what
We
you're
can
gonna
get our
get.
funds out in 24 hours. So you ask, well, why aren't we doing it? And Mark and I kind of asked the same question, why aren't we? Mr. Jackson is a strong advocate of this, and I think you'll hear more about it in other departments in the future.
Anybody got any questions on that at all?
I have a question.
Yeah.
So I know when you were talking about, using that health fund effectively, you mentioned salaries and paying staff a couple times. So I did want to kind of give an update on the vacancy report that we provided last month as far as how many of our positions are vacant. And we do have 19% of our positions vacant right now. We continue to receive comments from current staff, and then most of our exit interviews that we went over last month. As you recall, most people are leaving because they can go get paid more somewhere else. That goes for current staff, and then the difficulty with getting people to agree to interview to come here in the first place. And we've lost people that have a lot of seniority. I know we discussed, raise percentages and ensuring that those, were fair and were adequate, especially with the inflation levels and where they are. And so, I know we talked about it in finance committee, but not the full board. I would respectfully request that we do look at incoming salaries again, and most definitely current staff salaries, because the people that are covering the 19% of vacancies and probably more vacancies to come are our current staff, and specifically our supervisory staff. I do feel very, very strongly that needs looked at in general, and I know we've talked about it. And then I know we have some positions right now, we've talked a lot about, nurses and level 8 positions and general care coordinators, case managers. Now we're seeing this with licensed practical nurses as well, and also dental assistants. And so the problem is not, just in one area, the problem is not just at one level. We're hearing this over and over. We have employees concerned about paying bills. So with having, over $7 million in the health fund, I agree we need to invest in it, invest it, make it work. And I'm excited to hear more from John Jackson. But I would, respectfully request, with everything that I know and see here, that we do something, now, and that we don't wait until next year to ensure that our staff are adequately paid, because we cannot afford to lose more staff.
I appreciate those comments, but we're getting off topic here in regards to that.
I was just
What we're
talking
talking
about
about
health
right
fund investment.
Okay, I've got another thing that we wanted to cover, and I know Mike is kind of on a time scale. Do we want to move to jump down to that right now?
If that's the pleasure of the board.
Okay.
Yeah.
So, in the interest of time to make it work for everybody, I'm going to make a motion to go into closed session.
For the record, this will be pursuant to Section 2C1 of the Open Meetings Act to discuss the appointment, employment, compensation, discipline, performance, or dismissal of specific employees of the public body.
So, a motion to go into closed session.
Hold on, I have a question. Do you want them to stay for department division reports, or go ahead? I don't know how long.
I don't think there's anything that would require them to stay to go over anything on the reports.
Okay.
We don't have a lot of questions in regards to that. I'd like to give them the latitude to excuse themselves. It's fine.
Go ahead, go home. Yeah, go home.
So,
I'm gonna turn off the
motion to go
recording.
into closed session.
I'm gonna make sure Evan has a live stream.
Second by Caroline. Motion by Caroline, second.
Second.
I will log off. I am not sure. I can
Thanks.
Thanks, Luke.
Okay, it's, gosh, I can't hear that clock, 'cause I can't adjust it. It's 7:39. We are back in open session. And roll call, please.
Candy Clevenger.
Here.
Dr. Smith.
Yes.
Cody Parks.
Yes.
Dr. Minigonti had to leave. Debbie Hill.
Yes.
Jeff Etler.
Yes.
Mark Scranton.
Here.
Carolyn Wagner. Here. Dr. Turger.
Yes.
And Jan Hack.
Here.
Okay, we'll pick up where we left off, and in the interest of time and priorities, we will forego some other things that are on the agenda. Brandy, do we have a need to dive into the personnel manual tonight, or is that something we could review for next month, now that we've all got a copy of it? Is there something prudent that we need to do?
No, so the usual process is we review it every year at the September board meeting. And if there's any policy changes suggested throughout the year, that can happen anytime, but we just have regular practice of doing it at least once a year. And
Okay,
if there are any suggested changes, we do always send those through legal before we would bring them to the board for any kind of review and approval.
I would ask the board to take time between now and next month to review the manual at your leisure. If you find anything that you have questions on, direct them to Brandy. And if there's anything we need to make changes on, then let's do that at next month's meeting. We can have discussion, action on anything we think we need to make changes on to move it to legal for approval.
Brandy, is there a considerable amount of data about flex time in here?
You mean as far as how the policy works?
Yes.
Yes.
I mean, that's something I've got a high degree of interest in, and I just ask everybody to look at that closely, maybe kick around the thought of moving back to just a direct overtime pay. It's something we could talk about in a lot of depth.
Yeah, and we have the flex time thing on the agenda tonight, so I think we'll take that.
Yeah, it kind of
collectively
dovetails to
goes
this,
together.
so
We'll move that
it's really a
discussion
good
to
time
next month.
to pull that out.
Yeah, okay. All right, communication, board education.
The only two things, just communicable disease update. We did send this to you via email, but we, only have the two confirmed cases of monkeypox, or you may see it called MPX or MPV. We have vaccine and we'll be starting to vaccinate tomorrow. We have done some previous vaccinations as well. And then COVID, we're at low community level and still in high community transmission for healthcare facilities. And then the Board of Health meeting dates for 2023 were in your packet. So you do have all of those. If you see any problems or anything, certainly let us know, but we went ahead and just kept, third Tuesday of the month, and wanted you to have those dates as far in advance as possible. That's all I have, thanks.
Okay. Board of Health meeting dates for 2023. That's just strictly information, right?
It's in the packet.
Yeah. This is strictly information, right?
Oh, yeah, that's what I was just talking about, as far as it's in there. If you have any changes, let us know, but it's just,
Okay.
it's still third Tuesday of the month.
Okay, presentation, acceptance of financial report.
The report is through the end of August, and it's 75% into the fiscal year. Fund balance is at 7.4 million. Total revenue at 6.2 million, which is 88.9% of budgeted revenue. Total expenditures at a little over 5 million, which is 71.8% of budgeted expenditures.
Okay, anybody have any questions on the financial report as presented? Make a motion to accept.
A second.
Roll call.
All right, Candy Clevenger. Dr. Smith.
Yes.
Cody Parks.
Yes.
Debbie Hill. Jeff Etler.
Yes.
Mark Scranton.
Yes.
Carolyn Wagner.
Yes.
Dr. Turger.
Yes.
Jan Hack.
Approved.
All right, all yes.
Approval of, review and approval of department expenditures. I did have one question that relates to this. I was told that there's discussion about possibly moving AP back to the county. Is that an accurate statement? Is that something you guys are thinking about doing, or what's the status with that?
About moving something we're doing to the county?
What's that?
Go ahead.
I have not heard a single thing about that.
Yeah, neither have I.
Okay, well, I want to clarify that.
They are,
For the record, I was told that you guys have been having a conversation about moving that back to the county.
there have not been,
SAP.
no, there have not been any conversations involving us regarding that.
Okay,
They are reviewing, a few of our invoices now, every week.
Okay.
They look at our check run and select about 5 invoices, and we send those down to the auditor's office and they review those.
so they're just.
That's the only
randomly pulling
recent
stuff?
change that has been made to our current policies.
Okay,
Are we allowed to ask where that information originated?
that's just what I was told by somebody at the county, that
Yeah, first
that
we're
was,
doing
that
that.
was conversation that was being had, and I just wanted to clarify if that's the intentions or not. And if it is, then we need to discuss the reasons behind that in the
No.
process.
If conversations are being had, we're not involved with those.
Okay, all right. That's why I wanted to get some clarification on that. Okay, any other questions in regard to expenditures? Okay, get a motion to approve. Roll call.
Lavender? Dr. Smith?
Yes.
Cody Parks?
Yes.
Debbie Hill? Jeff Miller?
Yes.
Mark Scranton?
Yes.
Carolyn Wagner?
Yes.
Dr. Jerger?
Yes.
And Hack?
Grant applications for review and approval.
None?
Okay. Department division reports, staff has left. I don't know if anybody has any questions, they could ask that of Brandy.
I have one question with regards to the lead program. I noticed what Mr. Faber had sent, and I was just curious if we, I realized that WIC clients automatically get lead testing done with their hemoglobin. Is that 12 months? Is that when we're still doing it?
I don't remember off the top of my head.
But I'm, obviously, is that still a requirement by the state that has to be done prior to getting into kindergarten?
I'm not sure. I can check and find out. I don't remember off the top of my head if it's required for them to have that.
See, I always made them have it, but I don't know that they would have failed them if I hadn't done it. And it was rare that I would come across a kid that hadn't had it, but it makes me wonder how we're doing as a county, percentage-wise, of getting our kids tested for lead by even like 24 months. I'm just curious.
Yeah, I
He
can find that
he
out.
brings up a good point, and, we don't know if we're not following, if they're not all coming through WIC, which,
Right. Yeah, I could definitely find out what you know.
okay, thank you.
Okay.
Brandy, I didn't see nothing in Kathy's report. As far as where are we at with the new implementation of the new recording training and stuff, is that forthcoming still, or?
Yeah, they already started meeting. I mean, we signed the contract after the county process, went all the way through, and then they started, same with the nursing, electronic medical records, we've already started having the meetings to get things going, so. Moving along.
And I will ask once again for clarification of inspectors, who's doing what, because that seems to be missing from the report once again. So I've missed it somehow.
I can ask her to
We had
provide that
missed that for like
specifically.
3 months and then asked for it to be brought back as part of the package, and now it's not here once again.
I think she was just trying to make hers more consistent for what the other divisions were doing, where theirs were just reporting what types of activities were conducted, not necessarily broken down by every single staff person. But if you want that specifically for her report, I can definitely just tell her that the board.
I want to see it, and I don't have to ask again for it, because we brought this up before, because I think when we're talking about hiring somebody else as being advertised right now, I want to see more balance there between the inspectors, and right now it's pretty skewed, and I don't have those numbers here to look at, so it's kind of hard to evaluate where that's at.
I can tell her that you would like to require that, and then also if you do want to have a conversation, ever about like the staffing and what they're each doing in the division, I'm happy to
Okay,
have that conversation.
it's just easy to have that
get
to refer
insight.
to.
Yeah,
I don't, and we're not hiring.
no, I think it's already filled.
Yeah, we're not hiring for that.
There's an ad on Facebook on the health department's page looking for somebody.
We leave it until the person has actually started, so that might be where there was discretion. So if somebody has started, so if that was an error.
So you've already filled a vacancy that was there.
I don't know for sure when that was posted, but yeah, there's not a vacancy any longer.
Okay. I find it interesting, we're filling vacancies and we got, I don't know, a lack of balancing out how things are getting done. I don't know why there's a need to get somebody else in that department right now. And that's what concerns me, because I'm sitting here looking at it, and every month we've got the numbers to look at, and all of a sudden they're not here again. And the last time we had this conversation about that specifically, there was a great imbalance. You had two people that were doing about 80% of the inspections.
Well, they do have different job duties and job assignments, which is why I said I'm happy to like break it down with you and go through it, in detail if you want to sometime, because they have different responsibilities. One of them has additional duties specifically
Well,
assigned on
I'm not disputing
purpose.
that whatsoever. It's just when I look at the numbers of a couple people and they're in triple digit numbers.
Right, I
Other
understand.
people are down to single or double digit numbers. That's a huge discrepancy when they're all being paid, to do the job. You wonder why it's so out of balance.
Right, I understand. I'm just saying they don't all have the same,
And those new,
exact job.
I was gonna say, and that like new employee, you won't see, there'll be some training before you would see them having
No, I
a bunch of
understand
inspections.
that. I'm not questioning that. Okay. So, anybody else got any questions on the division reports? And we had tabled the presentation for starting point tonight, because that was probably going to be tight on time. And we probably wouldn't have the ability to do that tonight. What else? Anything else that I missed? Employee recognition, which page?
It's the last one.
It's the very, very last page. Oh, here we go, thanks.
Yeah.
Whitney Allison, 8 years. Sarah Stoutenberg, 7 years. Rebecca Stewart, 5 years. Loretta Lincoln, 2 years. Dr. Ken, our dentist, 1 year.
Give them an applause.
Yep. Okay, I believe we covered everything that we had on the agenda, unless somebody sees something like overlooked. I know it's kind of convoluted, bumping things around, but
I just have a question about your recruitment efforts. We still have 19 open positions, is that?
I believe it's 17 and it's 19% of the positions are open right now. So there's 91 total positions and 17 are open.
What, how do you recruit for those jobs? What methods?
So,
What you can, if I miss anything, let me know, but, so those are posted, here at the building. And then they're posted on our website, on the county's website, on Indeed. They're missing somewhere. but-
Facebook sometimes,
Oh,
and then a community outreach events. If we're, if we go to something where it would be appropriate, sometimes we go to things that are a little bit more recruitment specific. We would definitely take them then, like if we go to a class at Milligan or something, we would, provide that information in that capacity. If we do a more general presentation, we'll mention that we do have job openings and how, much of a variety they are, give examples. And so we have that personal connection with the community to try to recruit. And then, of course, we do have a lot of students coming through the building, not just nursing students, but other interns. So we always make sure to let them know to watch the website for open positions as well.
So do you get a lot of people through Indeed? That's kind of a mainstay for
We,
younger people, right?
we did a lot of applications. I guess I don't wanna like generalize because I don't have the
That
statistics
does
in
book
front
a lot
of
of
me.
people.
I was gonna say, but most of them are not qualified for the position.
Well, and I know that's an epidemic problem in the society, healthcare, construction,
Everywhere.
industry, but I heard your, a little bit of a plea a couple of times that that's a difficult job, and if there's something that we could do, or if there's some creative ideas that anybody could bring up to help you, if there's a way to fund something like a recruiter, if that would be of any help.
That's one of the things.
Creative ideas.
How far are you guys reaching out with the methods you're using right now? Are you just doing like right tight in central Illinois in like a 50-mile radius, or?
No, it's not restricted on there.
It's not. I mean, I will say though respectfully that our wages, it's just hard to compete. And I'm not saying that we're gonna be at the same level as the hospitals or some of our, counterparts that are similar, but I mean that people kind of dismiss it right away when they learn of the salary, if they happen to be interested. It is, of course, though, they do have to report to the office. It's not a remote job, which also, so like you said, I'm totally open to any creative ideas. As we talk about, and I'm not sure what the conversation regarding flex time looks like, but depending on, I think we do need to look at creative ideas, because if that is a benefit that we're gonna, that might not be there in the future, then I think we do need to get bump those salaries, or what does that look like of those creative ways to stay progressive in the job market right now? Because right now, I mean, employers are doing lots of creative, progressive things, and it's hard for us to compete against them.
What are your counterpart health departments doing? Because comparing health departments to the hospital has always been an age-old problem, and people have looked to the other benefits, not rotating shifts as a nurse, not working holidays. So, but what are your other health departments doing? What's Sangamon County, Logan County, Christian County, what are they doing for recruitment?
And are they at the same level of need? Are they down 19-20% or?
Well, most health departments are, as we talked about last month or the month before in finance, and I know that Mark himself looked into some of this too, that it's very different across the board, like all health departments, but I think that everyone's seeing the same challenges right now, whether it's a health department or something else, but other health departments, I think they also are having the same challenges, little to no applicants, but they're also of varying degrees and sizes, so, they might be missing one employee, so they're at that 19% just along with us, so I think that there's definitely those challenges there, but it definitely, it's hard to compare exactly, but we definitely have pulled that information. And we're in constant communication with our regional partners across other local health departments, and we constantly try to pull that data from Sangamon and from all the, other local health departments to see where we're at. It doesn't look, exactly the same as far as, because I think Sangamon, there's one, correct me if I'm wrong if you remember off the top of your head, but their pay is higher. There is a staggered shift in there too. I will say from my, experience, I do think that is common in the public health world, of flex time and even across the other county departments. So I think that's something that's people are used to if they're going from another health department to our health department. That would probably be something that they would expect, but.
Are most of the positions nursing positions, or what are the qualifications? What are you looking for?
Yeah, so most of our hardest positions to fill are those the level 8 professional level and up, so a 4-year degree. Correct me if I'm wrong, but there's only one nursing position I think available, but it's been vacant for well over a year, probably more. I'm
leaning on, what I'm really confident in saying there, that well over a year it's been vacant. But most of them are 4-year degrees or higher. We don't really have a hard time. It's much easier for us to fill the levels 1 through 7, because in those levels, I feel like our benefits are pretty great, because, you're not working a weird shift overnight. You're having a set schedule. You do get health insurance, or you qualify for health insurance, sick time, vacation time, where you wouldn't probably like at a fast food restaurant or something like that. So I think that those positions do tend to be easier for us to fill versus, the degree required positions, which are driven by our grant funders of what the requirements, for those programs are. If that makes sense or answers your question.
Could I request a list of the open positions, just to be able to review them? I think we
You
have.
have, I would say you should, isn't it?
Are they in the packet?
I don't think we added it again,
We
but,
got it in the budget.
I can
I
give
knew
you,
we did.
but I can give, yeah,
Maybe just a fresh one?
yeah.
You never know who you're
The
cross
board
paths with
and,
conversations.
Well, it'll give me a.
Do you want like our staff list with it, or you want just the vacant positions right now?
I'd say just whatever you think is, whatever's easiest for you. I can.
Okay, either
I can
way,
sit through it.
they're posted on our website, and I can just send you the link. We keep that pretty, like updated as it, like I said, and it's on the county website too. And then you can click on those and see the actual, it's listed like in a group format, just
And
listing.
does it say that they're level 8s?
And then if you click on the posting, then it goes to the actual posting, and you can see what level and everything.
I will do that.
I can help you.
But why don't you send us just the short list of the 17, and then everybody can quickly at a glance.
I will say, because I want to make sure that I get to what you're requesting. So you want me to send that to everyone? And I will say, so like in my report that I give you, it has the positions that, well, when I put the report together that day, what the vacancies were,
Sure.
but it has, but it doesn't necessarily like say how many we're hiring for each position. So I can clarify that.
Okay.
Because it has, like, right now there might be 6 or 7, or I forget how many positions, or jobs, job descriptions, but then some of them, there are multiple vacancies, if that makes sense.
So this might be really old school, but just a thought, sometimes that's what you gotta do, because this day of technology and stuff, everybody's like, you can't read a person on a piece of paper. And I'm not aware that the health department has ever done this in the past, but what about going out to some community events, like going to like the chamber breakfast and talk about what's going on at the health department, and tie that job need in to spread that word out verbally to a group of people of the community. Because honestly, unless somebody was going to look at our Facebook page right now, I bet you 90% of people out there have no idea that we're looking for help. So, I mean, I'm just thinking about, and nothing else, you got other things to talk about. Hey, what's new at the health department? You could talk about what we're doing with the food stuff. You could have a little story to tell at like chamber breakfast, for example, something like that, or the Rotarians, or some of the other civic groups around. I don't know if you guys have ever done that in the past, but to me, you got a captive audience, you got them for a short period of time. Talk about what's going on here,
We definitely have, and that's what Brandy said also when we were going through all the places that we advertise for jobs. She
yeah, we've
mentioned
done
that.
tons of that for years. Doesn't mean that we can't get into new places though.
Yeah.
We're pretty short staffed on who can go kind of do those presentations, but we have, been pretty active with that and,
That
enjoy
workforce,
doing that.
they're on the news every night, and they're making brochures, and stuff for people, the packets, to go in and pick them up, and, that would be something you could call Rocky and ask her.
Yeah, we can check into that.
Yeah, because she wants hard at doing what she
Yeah.
does.
Yeah, and.
So I mean, just
and we
something to
work
think
with
about,
her.
because if
Yeah,
nothing
we
else,
partner with her.
Yeah.
tell the story about what's going on at the health department. You you've got a lot of business professionals that belong to the chamber, go to the chamber events and stuff, you know.
Do they go to like the job fair at the Holiday Inn when they have that twice a year, or whatever, that do go to that at all?
Well, they probably don't.
The attendance for those things is
No,
horrible.
I said no, we haven't.
There's more people there doing the event than people that show up,
Yeah.
which is crazy.
Yeah, it is, yeah, when there's nobody.
It doesn't make any sense. I mean, I had a guy tell me the other day, they had, just a few years ago, they had over 200 people show up, and they would weed out about half of them, and now they had like 60 people show up, and by the time they got done, what they weeded them down to, and the ones they brought back, they had like 6 people.
Wow.
After they went through their
Well,
little
The railroad,
process.
the railroad comes in every day and they say they cannot even get 2 or 3 applications.
It's a tough problem. It's not just the pay, it's the mentality of what
It's a
we're
whole different
dealing
world,
with post-COVID,
whole
because
different world now.
I don't know how people are surviving, I really
Me
don't. And I've
Public
got,
aid.
there's other people out there, you know, I see it in her business, when I go on there, you see all these guys that are working for different companies going in and out of there and stuff, and people just cross paths with, there's some guys out there, they're just absolutely busting their butts to just try to have a job and make
They don't
ends
get a
meet,
day
and they're
off.
not making a lot of money.
We have a lot of staff like that too, and that's part of why I keep bringing it up, you know, I don't wanna lose staff because we've got really good people. If we lose more people, we're in trouble, you know? Because you're right, it's hard to find people,
It really is.
good hard workers that are committed, you know, show up and everything. So we are grateful for sure for the ones that we get, and we're sad about the ones that we've lost, and wanna get creative in whatever ways that we can.
Okay, anything
Get more
else
people in the
for
building
discussion?
and keep people that we already have.
I don't have anything, I just was pointing out, unless that was intentional, because you asked the review of the Board of Health bylaws. Was that intentional, was it Skip?
Oh, I'm sorry, I overlooked that. I thought we were gonna just do that with the personnel manual for next month.
Okay, that's fine, I just didn't know
Yeah,
what
thanks
you were.
thanks for pointing that out, okay. Anything else? Motion to adjourn?
You're good, if we,
Okay.
if there's no business, we don't have to go call our motion.
Thanks, everybody.
Thank you.
Did you get that picture?
Do you have a clean sheet of this? Do you have a clean sheet of this?
That's not my friend.